My role in the peripheral nerve injury unit in London really aided my aesthetic work in several areas. First of all, you've got to have meticulous tissue handling. You've got to have skills with microsurgery, so you've got to have a very steady hand. And this really feeds into the aesthetic work. You can't bruise a nerve, you can't crush a nerve, you've got to treat it so gently. And when you're handling fine tissues in the face or around the breast or the abdomen, that has got to be brought through into it as well. You can't crush the tissue, you've got to handle it delicately, otherwise you're going to get poor healing, wound breakdown and all the sort of problems that you hear about in the news or in the media. The other major area that doing the reconstructive surgery feeds into the aesthetics is that you get a huge and in-depth knowledge of the anatomy behind what you're doing. So you actually know not just the surface, but what's underneath, and the layer below that, and the layer below that, and what's making it all work. And so it all ties in actually. So almost without the reconstructive background, it's very difficult then to do a really good job on the aesthetics. Actually doing it in practice, being in that particular area day in, day out, handling the tissues, knowing where the nerves sit, knowing where the muscles should lie exactly and how they need to go back if you want to solve a problem, for example. All that feeds into your ultimately the result you're going to get for the patient when you do the surgery. Yeah. So without doubt, having a strong reconstructive background and also a specialist reconstructive background feeds into what you're able to produce for your patients aesthetically. The nerve injury side of my practice was related or is related to principally trauma patients who have had a major injury, usually something like a motorcycle accident, and they've unplugged the nerves from their neck. Now they can be pulled apart, or that's called a rupture, or even unplugged from the spinal cord, and it's basically about undertaking operations to try and rebuild function in the arm, a bit like complicated wiring or electrics, I suppose, to rebuild function in the arm. I do have a super subspecialist interest which involves taking muscles from elsewhere in the body with their blood supply and their nerve and then plumbing them into somewhere in the arm to improve function, be it finger flexion, elbow, so making a fist, straightening the fingers out, or bending the elbow, all of those sort of things. So that's my sort of super specialism. My experience stretched primarily in the upper and lower limbs, but I also have a strong background in facial reanimation and using bits of muscle from elsewhere in the body to reanimate the side of the face if it's not working, for example, after Bell's palsy, or a common scenario that one would see someone with paralysis in the face is following a stroke, though they aren't generally the sort of patients who you do the reconstruction on. So I have an ongoing interest in peripheral nerve injury, both on a private basis and currently as an honorary basis at a teaching hospital in London.